Today I'm going to do a lecture on the circulatory system or circulation. Just remember, circulation is part of the cardiovascular system. And basically, we're going to depend upon, for the circulation system, depend upon a pump. So when you think of the word circulation, is going to depend upon a pump. And that pump, in effect, is going to be the heart. And so what I want you to do is just think about the heart just very generically right now. Just remember that we have a four-chambered heart, and that four-chambered heart is going to have a right atrium and a right ventricle and a left atrium and a left ventricle. And always think of it as being the right side of the heart is going to have venous blood, and the left side of the heart is going to have arterial blood. And so therefore, knowing that and knowing those four chambers, remember you're looking at anatomical position, so just always remember when you're looking at a body, my right hand when I'm standing in front of the patient, or right now standing in front of the heart, this is my right hand, but this is actually my left side of my heart. So whenever someone starts talking about taking pulses or listening for some sounds, you're looking at the patient anatomical position, but they're looking at your left is their right. All right, so we know we've got this four-chambered heart. We know we're depending upon this pump, and therefore we're going to break the circulation down into three circuits. And those three circuits are going to be, the first one is going to be called the systemic. And the systemic circuit, just think about it. What it's really got a goal is to perfuse, and a lot of times I also say or supply, because a lot of times you don't know what a perfusionist is. Just so you know, a perfusionist is, if I was running a heart-lung machine, a perfusionist actually runs the heart-lung machine when you're doing bypass surgery. So it perfuses or supplies the body or the somatic cells with oxygen, and it carries away CO2, carbon dioxide. So I always tell people to remember that O2 is going to be your nutrient gas, and CO2 is your waste gas. So that's my systemic circuit. So let's think where it's going to start and where it's going to end. If we just said that this is arterial blood over here, so therefore the systemic circuit is in effect going to start at the left ventricle. It's going to go to the body, and it's going to go through the body and then supply or perfuse the body cells with oxygen, pick up the CO2, and it's going to send that blood back to the right atrium. So starting at the left ventricle, supplying the body with oxygen, picking up the waste gas CO2, returning that blood back to the right atrium. So that's going to be the systemic circuit. All right? In order to do that systemic circuit, you're going to undergo what's called internal respiration. Internal respiration is defined as gas exchange between a systemic capillary and a body or somatic cell. Okay, so that's going to be my systemic circuit. The second circuit we're going to have is going to be called the pulmonic circuit. The pulmonic circuit, now we're thinking of pulmonic lungs, pulmonary. So therefore, what do you think about the lungs, what they're going to do? The lungs are going to what? They're going to perfuse my red blood cells with oxygen. So therefore, in order to do that, the pulmonic function is to perfuse or supply red blood cells with oxygen and carry away CO2, carbon dioxide. So if we're going to send now blood to the lungs to get perfused, I'm going to have to start somewhere in the heart that's got venous blood. So that's going to be my right ventricle. So therefore, that's going to start at the RV, or right ventricle. So it's going to come out of this right ventricle. It's going to go from there into the lungs. Into the lungs, when it does that, it's going to undergo external respiration. External respiration is defined as gas exchange between an alveolar capillary so just remember, if this is an alveolus or an air sac in my lung, and this is an alveolar capillary sitting over here, and sitting inside of here is a red blood cell. So this is going to be gas exchange between an alveolar capillary and a red blood cell. So as this red blood cell passes through here, that alveolar capillary is going to pick up oxygen from the alveolus that you took in when you took a breath of air. So it's going to bring oxygen in. When you take a breath out, it's going to carry away carbon dioxide. So just remember the two significant differences there. And these are very, very important things to understand. I'm just going to go back up here to make sure you see the difference. Because in internal respiration, we just had a systemic capillary, right? So that's a systemic capillary. It's got a red blood cell sitting inside of it. But what it's doing is this is just a cell inside of my body. This could be an example of a liver cell. It could be a skin cell. But what I'm doing here is I'm taking oxygen and sending it into the cell, and I'm carrying away the carbon dioxide. Over here, what I'm doing is I'm bringing oxygen into the red blood cell and carrying away the carbon dioxide. All right? The third circuit that we've got is going to be probably the most important one, because without that, none of the other circuits would function. And therefore, that's going to be let me finish this. So it starts at the right ventricle. I'm sorry, I need to go back up here just for a second. So I started at the right ventricle, I went to the lungs, I had external respiration, I defined that, and then where am I going to end up? Well, just think about it. If I started over here in the right ventricle, and I went over to the lungs, I've got to go back into the heart and start all over again so I can perfuse the body with oxygen, so I'm going to end up in the left atrium. So that's the pulmonic. And finally, the third circuit is going to be what's called the coronary circuit. The coronary circuit, remember, just by the name coronary, that means it's going to work on the heart. So therefore, that's going to perfuse or supply the heart muscle. Remember, the heart muscle is going to be called the myocardium with oxygen. and carry away carbon dioxide. So that's going to be your coronary circuit. Now, to understand the coronary circuit, I'm just going to go to a fresh page and so you can understand that. So this is just a carry-on of the coronary. Let's just say coronary circuit continued. If what I was doing there, where was I taking blood from? Well, to make this easy without flipping pages back and forth, here's my four-chambered heart again. RA, RV, LA, LV. Remember, this is going to be arterial blood here, and this is venous blood over here. If I'm in the coronary circuit and I want to perfuse my heart with blood, I've got to start at the left ventricle. So this is going to be a little bit more complicated, but I'll make it very simple for you. I'm going to start at the left ventricle with arterial blood. I'm going to go into a vessel called the aorta. I'm going to go from the aorta, and when it bifurcates or splits, one of the bifurcations or splits is going to be the ascending aorta, the AA, and the DA, descending aorta. It's this one here that I'm going to be concerned about with the coronary circuit, because the ascending aorta, as it goes over the arch of the aorta, is going to take a flip and it's going to go into two vessels, and that's going to be called the RCA, which stands for the right coronary artery, and the LCA, the left coronary artery. The right coronary artery is going to supply the right side of the heart, of course, and it's going to do that by splitting off into two branches. It's going to branch off into the marginal artery and the posterior interventricular. So just think that blood, it leaves the left ventricle, comes out of the aorta. Once it gets in the aorta, it splits into these two branches, but I'm just concerned with the ascending. It's going to split off into the right coronary artery and the left coronary artery. It's this left coronary artery that's going to supply, and this is where it's probably the most significant, I'd say, in the entire body as far as circulation. It's going to supply two vessels, and those two vessels are going to be the circumflex artery and the next one, which probably everyone's heard about. I'm going to give you a couple different names. It's called the anterior interventricular. It's also called the left anterior descending, or the LAD, and then the LAD is going to also be called the widowmaker. And the widowmaker is very significant because that's the one that is most commonly occluded with the circumflex. So, for example, if you said you had a family member that was in the hospital and had to have a quadruple bypass, that means that I took a vessel from your leg, unless I used an artificial graft from the saphenous vein of the leg, and I grafted into four vessels. So I'd take that, graft it into the marginal artery, the posterior interventricular, the circumflex, and the anterior interventricular. That would be what would be called a quadruple bypass. And now find the significance of all of that saying is this widowmaker is significant because that is going to supply or perfuse. That's why I said it's probably the most important thing of circulation. It's going to supply or perfuse three different important chain structures. So if I just take that box heart rate here and just make it nice and simple for you for today. And so here's these two lower chambers down here, and here's the wall between them. And that wall, so this is going to be the right ventricle, this is the left ventricle, and this structure right here is called the interventricular septum. And this left anterior descending is going to supply or perfuse the right ventricle, it's going to supply or perfuse the left ventricle, and it's going to supply or perfuse the interventricular septum. So that's why I always tell students, if I was having chest pain and you took me in the emergency room, I would have a normal EKG until I had a heart attack. So the only way I could see if I was having a heart attack or one was evolving, I would have to do an echocardiogram. And the echocardiogram would show wall motion. That's why these are so important to understand the circulation of the heart, or what's called the coronary circuit. So now we know the three circuits of the body. And now the next thing we want to think about, since we know the circuits of the body and where they start and where they end. So again, remember, this started out, just to refresh your recollection, so we started out where? At the left ventricle. So we begin at the left ventricle, like I showed up here. We went and supplied the left and right coronary arteries. So that was, remember, that was the starting point. After we supplied those arteries here, so I'm just going to bring it back down to here again, so I need to really so you understand this. So remember, you've got your RCA, LCA, we've got those branches, and I'm not going to write them again for you. But you remember the right coronary artery and the left coronary artery, what they're going to have to do is they're going to all come together, and those vessels now have to supply or perfuse the heart. So what matter whether they're out of the left or right, they're going to supply the heart or the myocardium with oxygen. They're going to carry away the carbon dioxide. They're going to send all of that blood is going to go into the great and the middle and the small coronary veins, and then the great and the middle and the small coronary veins are going to return that blood back to the heart. So therefore, they're going to split off, and of that blood, and this is again why it's so detailed and significant, 80% of that coronary circuit venous return is going to go into the right atrium. 80% of the coronary circuit venous return is going to go back into the right atrium through the coronary sinus. And 20% is going to go back of the coronary circuit, I'm just abbreviating, venous return, is going to go into the right ventricle via the small cardiac veins. So therefore, the significance of all of that is that this is where it's really unique, where you have blood returning to a pumping chamber. There's no valve there. So this is returning to a collecting chamber, but this is the difference, is this is returning 20% to a pumping chamber. And I believe the reason is it's kind of a redundant system, that if you had so much blockage in this vessel, this would be able to uptake that remainder and carry all the blood into the heart. All right? So now we know about the three circuits. We understand where they began, where they ended. I guess the next thing we probably want to take a look at maybe would be what a blood vessel looks like.
Yeah, let me ask. Can you talk specifically about the linings of a vessel?
Yeah, vessels are really interesting because they're really pretty generic. Whether it's an artery or a vein, they all have traditionally what I would call different lining layers, and of course, the thickness or the presence of them would all kind of depend what they were, whether they were an artery, a vein, arterial, venule, aorta. And so if we were to draw a blood vessel, it's very simple to do what I would call a generic vessel. And we're going to have a lining of the vessel, and the lining of the vessel is very simple, looking like this. So here's your lining. This could be any vessel in the body, always the same. Then you're going to have another layer outside of it, and I'll kind of do it like this with a squiggly line to show there's a second layer. And I'll put it on both of them so you can see that it's really a transverse cross section of a blood vessel. And then there's a layer outside of that, and we'll just make this little bit more circular squiggles, I call them, over the top of it, and that actually is our third layer. And this could be an artery or a vein, and so therefore, remember, the inside of any tube, whether it's the intestine or a blood vessel, is called the lumen. So that's your lumen. So the lumen has lining A, so that's the first lining. A is going to be called the tunica, which means coat, and it can be intima or interna. And that's going to be a simple, remember, simple means one layer, squamous, which means flat, and it's endothelium. So remember, simple, one layer, squamous, flat cell, endothelium, lines, or covers. So that's my inside lining, just one layer. Now I've got my second layer here, B. B is going to be the tunica, which again means coat, and that's going to be the media. And the media is going to be generally smooth muscle, with some exceptions. And then I've got the third layer, which is here, so this is C, and C is going to be the tunica externa, or adventitia, and that's going to be connective tissue. And that connective tissue will probably contain either elastin and collagen. So whenever you see CT or connective tissue, the abbreviation CT, think elastin or collagen. It's that elastin or collagen, when that gets hardened, we used to have that old term hardening of the arteries or hardening of the vessels or arterioatherosclerosis. That's because this elastin collagen allows me to vasoconstrict and vasodilate. So you can imagine that if I have a blood vessel that looks like this, and that's the L or lumen, and I have a blood vessel that looks like this now, and that's the lumen, this vessel has vasoconstricted. And that vasoconstricted, and it probably won't function as it used to function because I've got hardened the arteries. I may have developed high cholesterol levels or plaque inside of my vessels. So that's kind of the big picture of that. So just remember, not all vessels will have this tunica media because your capillaries couldn't have it because they're for gas exchange. My really big vessels like the aorta, femoral arteries and that, they're going to have all three of these layers. And then of course the tunica externa is always dependent upon how much elasticity I'm going to have in that blood vessel. I guess the next thing we need to probably address is the type of
Muscle. What type of muscle do you find in
well,
a
again,
blood
that's the
vessel?
kind of exception to the rule that we talked about here for a second. And just remember that you've got, I said, generally it's smooth muscle. So again, if we go back and draw the heart, so I'm just going to make the heart very, very simple right now for you. And since this is my four-chambered heart again, and that four-chambered heart, remember you're looking down at your right atrium, your right ventricle, your left atrium, and your left ventricle. Remember that I've got to get blood out and I've got to get blood back in. So coming out of my left ventricle is going to be my aorta, which is going to bifurcate or split into the AA, ascending aorta, DA, descending aorta. And remember, these are chambers you're looking at here. So these are heart chambers. And once we get to talk about the heart in more detail, but today we're talking circulation. So this is actually myocardium you're looking at right here. This is heart muscle. And therefore, I'm drawing this really not to scale because these vessels are actually inside of the heart wall, but I'm trying to draw them so you understand them. But as these vessels are exiting the heart, they're going to have cardiac muscle as they exit. So, and the other two are coming into the right atrium. So here's these two big vessels coming in here. And that's going to be the SVC, the superior vena cava, and the IVC, the inferior vena cava. So those four vessels, as they enter or exit the heart at their proximal portion, will have cardiac muscle. So therefore, always remember that blood vessels generally are smooth muscle, except the proximal portion of the AA, ascending aorta, DA, descending aorta, SVC, superior vena cava, IVC, inferior vena cava. So as these vessels here return blood back to the heart, they're going to have cardiac muscle at their beginning portions. As these blood vessels exit the heart, they're going to have cardiac muscle at their beginning portions, and then they will spread out into smooth muscle as they traverse the body. But that's the significance. And of course, when we talk about the heart and learn about a heart attack, that what kind of makes the difference between a minor heart attack or a major heart attack, and how something can evolve depending on how close it is to one of the great vessels.
So that leads me to another question then. So does that mean, do all arteries have arterial blood, or do all veins have venous blood?
Okay, well, kind of think of that. I'm sure you all remember the days when you were a fetus. And so when you were a fetus, because I remember those days, they were difficult. You know, I didn't have wireless at the time. But if you kind of think, here's your mother. So here's mom. I'm not sure if she looked like that. But sitting inside here was her uterus. So here's your mom's uterus. So this is the mom. And this structure here is just a representational anatomy of the uterus. And the uterus really is going to have a lining. And let's put you over here. So this is you. And this is the fetus. And coming out of your umbilicus here was a structure, and I'm just going to put two of them in here just for today's purposes. And so there was and these are variations, that's why I'm just putting two. This is going to be the UA, and this is going to be the UV. That's going to stand for the umbilical artery, and that's the umbilical vein. And that umbilical artery, umbilical vein are going to go into this structure here that's actually connected to your mother's endometrium of her uterus. So therefore, this is the placenta. And this lining of your mom's uterus is the endometrium. And so the question always arises, did you normally, as a fetus, have your mother's blood coming through your body, or vice versa, as a fetus, was your blood going through your mother's body? And the answer is no. And the reason I can prove that is because if that was true, then you could never have a different blood type than your mother. You would probably have instant agglutination and death of the fetus or the mother or both. So therefore, the umbilical artery, the UA umbilical artery, is going to be taking venous blood. So it's UA has got venous blood from the fetus, and it's sending it to the placenta. The placenta is what I generally call the fetal lung, and it's going to exchange gases at that point. So half of the placenta is owned by your mom and half by you. Your mother is going to send oxygenated blood over, and you're going to send back deoxygenated or CO2 back to her. So the umbilical artery is going to take venous blood from the fetus into the placenta, and the umbilical vein is going to take arterial blood from the placenta back into the fetus. And there's variations on that. Some people have one umbilical vein and one umbilical artery. Some fetuses have two veins and one artery. Some have one vein and two arteries. Some have two arteries and two veins. And if we were studying embryology, we'd probably see there are some malformations and other abnormalities associated with that. So those are the first of the two vessels that where they're generally, again, veins have arterial blood, arteries have venous blood. These are two exceptions to the rule, and then there's two more exceptions. Those two exceptions are you after birth, or I call it the adult stage. And just remember, when you were a fetus, you did not use your lungs, but they had to be alive for the 9 months, otherwise you would be born with dead lungs. I said that there's actually 4 transposed vessels. Well, we know that 1 is the umbilical artery, and 2 is the umbilical vein. Whether they're umbilical arteries or vein depends on how many you have. Remember, that means this artery has got venous blood. This is a vein that's got arterial blood. So we got 2 of them done. Now we've got 2 more. But remember, these are in the fetus. But once I'm born, my lungs are no longer functioning. I don't have a placenta, I've got to do gas exchange. To do that, I've got to have 2 more vessels. Number 3 is going to be the pulmonary artery, and 4 is the pulmonary vein. Normally, naturally, there's only going to be 2 pulmonary arteries, and there's normally going to be 4 pulmonary veins. 1 pulmonary artery in each lung, 2 pulmonary veins in each lung. If I take a look at a lung, I know that I've got blood coming in, and that's going to be the pulmonary artery. And that pulmonary artery coming in, where did it come from? Well, it came from the right ventricle. So the right ventricle of the heart, the RV of the heart, sent venous blood into the pulmonary trunk. The pulmonary trunk went into the pulmonary artery. Inside of the lung was a alveolus, and I underwent external respiration. I took gas exchange and brought oxygen into the red blood cell and carried away the CO2. Coming out of each lung are two veins. So these are the two pulmonary veins. So these together are the pulmonary veins. And those pulmonary veins now are going to have arterial blood. So the right ventricle sent in venous blood, undergo external respiration, sent that back out to the pulmonary veins. The pulmonary veins, they can only go one place, and that is they're going to go into the left atrium, and then it's going to eventually to the left ventricle and enter the systemic circuit. So that's the way you want to picture the four transposed vessels and their significance. The other thing I think probably we need to just cover is a little thing about maybe blood pressure.
Yeah. So, what is the real meaning? Like, if I have 140 over 100, what do those numbers mean?
Okay. Well, you've all probably had your blood pressure taken, or hopefully had it taken. And of course, there's two terms that you want to define, and one is systole. And systole means heart pumping. And diastole, which is heart relaxing. And sometimes you'll see that's called a systolic, or this is called the diastolic pressure. So when you measure blood pressure, you kind of think of how it's done. And if we were doing a lab or you were having your blood pressure taken, I'd wrap a cuff around your arm. As I wrap that cuff around your arm, I'd pump it up, and let's just say I guessed that, let's pump it up to, let's say that Marco here just said to me that an example that he said his blood pressure was 140 over 100. So he came in and he said, I'm feeling kind of a headache lately. I feel kind of stressed. I have a lot going on in my life. I have a terrible diet, and my family history is hypertension. So I'd say, well, let me pump up that blood pressure cuff to 200. And once I'd pump it up to 200 and slowly release the valve. And as I released the valve, I would cut the heart sound off once it got to his systolic pressure. And so if that was the example, as I pumped up to 200 and released the air out of the valve, once I got to 140, I would start hearing heart sounds, and those are called the Korotkov sounds. And I would hear those Korotkov sounds, and those I would keep hearing kind of a blub, 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 eventually sound going down until they stopped. And when those sounds stopped, that would be my second sound, which would be my diastolic pressure. So this is your systolic pressure, which is the pumping, and this is your diastolic, which is the heart relaxing. And if I take 140, which is the systolic, minus the 100, which is the diastolic, is going to be 40, and that's your pulse pressure. So that's the significance really of blood pressure. And of course, we could spend hours and hours thinking about blood pressures, but I think, if you ever do a lab or you have your blood pressure taken, it's really significant to understand what you're really doing. You can see that, just an example, once you start getting these pressures really high in that, naturally you have the problem of getting a CVA or a stroke. When you get hypotensive, you think of sepsis or some type of severe infection. And then, of course, once these two numbers, the closer they get, it's oftentimes called impending doom or impending stroke. So I think that really covers what I think we need to see with circulation. It's a very, very important topic to understand the circuits and how the circuits really work at the heart, and knowing, understanding the systemic, pulmonic, and coronary circuit all work together. And that's really all I can really tell you about circulation. And have a great day, and thank you.